You're from the UK?
Yes,
Cambridge?
I am. Yes, from Cambridge, from the
Sounds
UK.
very posh.
Yeah, maybe. But
Sounds like an excellent place to study.
yes, it's lovely, and there's lots of very beautiful buildings. And if anyone is a fan of Harry Potter, some of it is filmed there. So
Are you?
take a trip. Oh, who's not a fan of Harry Potter? Let's say. So yes, thank you. So my name is Jessica Martin, and I'm a final year PhD student at the Cognition and Brain Sciences unit at the University of Cambridge. I work with Dr. Kate Baker, who's a clinical geneticist but also a researcher, and we work on an umbrella project which we call Bingo. And this project aims to better understanding of both mental health and cognition in individuals who have a rare genetic neurodevelopmental disorder. And today I'm going to be presenting some of my work which is aimed to better our understanding of social, emotional and behavioural characteristics in DDXX-related disorder, focusing on anxiety and behaviours that challenge. So firstly, I just wanted to say I'm really honoured to have been invited back after presenting at the first International DDXX conference in Paris in 2023. And there's me with some of the other speakers you can recognise. Angela here and Milu, and then there's Andrea who will be speaking later, and there's many others, but the photo is...
So Cornelia, who is with us today, apparently.
Yes, where are you? Here?
This is the bottom, next to Justine.
Here.
Justine, Helen,
And Cornelia here, perfect, thank you. So many of the colleagues today have given a really great overview of DDXX-related disorder, but just to kind of recap, DDXX-related disorder arises when there are changes in the DDXX gene, and it's thought to account for 1 to 3% of cases of intellectual disability in females where there is no other known cause. Currently, the pathogenicity in males is unclear, but as Milu just showed us, we now know that males can go on to have DDXX-related disorder, and they might present with similar characteristics, in particular things around intellectual disability, autism, and ADHD. And we know that the majority of individuals, as I've just said, have some level of developmental delay or intellectual disability, but the severity of this varies quite greatly between individuals, so not everyone will go on to have severe developmental problems, but they might be more mild than others. And Angela has told us lots about the kind of communication abilities of girls with DDXX-related disorder, and we know that around 50% of individuals will go on to be minimally verbal. So DDXX-related disorder has been associated with a wide range of neurodevelopmental and emotional behavioural problems, and today I'll be focusing... the animations aren't working, so we just have to go with everything on the screen. I'll be focusing on self-injury and anxiety today. So what is anxiety? So anxiety is a normal response to stress or danger, but this becomes a problem when it happens in the absence of danger or the response is much stronger than the situation calls for. And when this happens, it can interfere with an individual's daily life. Behaviours that challenge refer to a group of behaviours that can negatively affect a person's quality of life, physical safety, and emotional well-being, as well as the well-being of others around them. It includes behaviours that are directed towards the self, such as self-injury, directed at others, like aggression, or directed at things like property destruction. And to date, there's evidence of high rates of both anxiety, self-injury, and aggression in individuals with DDXX-related disorder. And although these behaviours are really common, we don't know whether they're specific to DDXX-related disorder, or maybe they're actually expected given the severity of developmental delay, and we see them across individuals with different rare genetic conditions. So previous work in the kind of Bingo lab wanted to look at whether there are differences in the social, emotional, behavioural characteristics of girls with DDXX-related disorder than girls with any other single gene cause of neurodevelopmental disorder. So we recruited 23 individuals in each group, and they were matched in terms of their age and their developmental delay or intellectual disability, and we collected parent report measures of adaptive ability, which includes things like your comprehension, social skills, and daily life skills, as well as emotional behavioural problems and autism characteristics. This previous work found no group differences in overall adaptive ability or level of autism characteristics, but we found that anxiety and self-injury were significantly higher in girls with DDXX-related disorder compared to girls that had any other single gene cause of neurodevelopmental disorder. So what does this really mean? Does this mean that anxiety and self-injury are greater than we'd expect for the severity of developmental delay in girls with DDX-related disorder? Or is this perhaps a reflection of our study? So we only have 23 individuals in the group, so that's a very small number of people compared to how we know there are kind of almost more than 1,000 girls now diagnosed with DDX-related disorder across the world. But also we only asked about a very few number of injurious behaviours. So I think we only asked about kind of self-biting, self-hitting, and kind of head banging. So there's actually probably a much broader range of self-injurious behaviours that someone could engage in. So maybe we're only picking up on some things that are going on here. So in my PhD, I wanted to better characterise the characteristics of anxiety. So what maybe are the triggers of anxiety, what the specific behaviours that are associated with anxiety, as well as how people might respond or cope with anxiety, as well as the different types of behaviours that challenge. So what are the different behaviours that children are actually engaging in? And this is really important to kind of do deeper characterization when we're thinking about interventions. So are there interventions that already exist that we know work for children that maybe don't have a developmental disorder, or maybe children that do have a developmental disorder like autism, and can we use those interventions also in children with DDX or X-related disorder if they present with a similar range of emotional and behavioural difficulties? I also wanted to use interview methodology to kind of gain a deeper and richer understanding of complex emotions and behaviours rather than just using kind of standardised questionnaire measures. And then beyond this, we wanted to look again in a different cohort of children whether we find anxiety and self-injury are greater in DDX or X-related disorder, and that this wasn't just an artefact of our study or kind of specific to those 23 children that were included in that study. So what did we do? I recruited children aged 3 to 18 years old that had a difference in the DDX gene. I also recruited children that had a difference in the CAS gene. So this is another genetic condition that is located on the X chromosome and predominantly affects girls. And then I also recruited children that had a variant affecting any other single gene, but was linked with neurodevelopmental disorders. And all of these children were required to have experienced some severity of neurodevelopmental difficulty. So parents and carers were asked to complete a range of questionnaires online, and this included measures of their kind of demographic information, so sex and age, as well as medical history, adaptive ability. Then we collected some measures of autism characteristics, as well as an in-depth assessment of repetitive behaviours, as well as a general measure of emotional behavioural problems, and then a specific measure of anxiety and behaviours that challenge. To kind of look at anxiety in more detail, we also invited parents to take part in an online interview, and this included thinking about anxiety within a clinical psychology formulation framework, so we can look at both what the current issues are, what might predispose anxiety, and what might maintain the difficulty. So we asked about what children do when they're anxious, what thoughts they might be having, how frequent, severe, and what was the impact of the anxiety, as well as the child experienced any kind of low mood or depression symptoms, if they had a family history of anxiety, and then what is triggering the anxiety and how do parents and children respond to the anxiety when it does emerge. So in total, I recruited 36 individuals with DDX X-related disorder, and they lived all across the world, but their parents or carers were required to kind of speak English to be able to take part in the study. They were aged, as I said, between 2 and 18 years old. We had 2 males in our study, and we had a range of developmental delay and intellectual disability severity. So what did we find? So on a questionnaire measure of anxiety-related behaviours, we found that the majority of individuals were scoring on this questionnaire in a moderate to serious problem range. But I just want to note this is not a diagnostic measure, but it's looking at kind of variability within symptoms. And what we find is that even though a lot of the children are scoring within this moderate to serious range here, you can see that actually the spread of symptoms is really big. So children kind of, even though they're scoring in this high range, kind of look very different from each other. But this questionnaire doesn't really tell us more than kind of how many anxiety-related behaviours children are engaging in. It doesn't tell us about what might be triggering anxiety and how families cope and respond with anxiety. So that's why we wanted to conduct some interviews to kind of learn more about the situations in which children experience anxiety, because that might inform how we would then go on to intervene. So 28 parents completed an online interview, and 19 of those children within the study had parent-reported anxiety. And this anxiety occurred in bursts, so it was triggered by specific events rather than occurring kind of at a constant level, which is what we'd think of more as like generalized anxiety. So this was kind of situation-specific. And we found that this anxiety was somewhat frequent, occurring at least once a week in most individuals, and had a mild to moderate impact on family well-being. So, what were some of the kind of common triggers we found? In kind of the top trigger was either new situations or sensory overload, as well as routine changes and being separated or being alone from the caregiver. In terms of behaviours, we found that anxiety was associated with increases in crying, repetitive speech, muscle tension, kind of talking to others, but this didn't necessarily have to be kind of coherent speech, but just kind of trying to initiate and engage in conversation, as well as self-injury and the need to flee, so to get out of that situation that is causing anxiety, as well as having a tense face. And then in terms of how parents and carers kind of responded to or used strategies to kind of reduce this anxiety in the moment, we found that distraction or redirection was the most common strategy. So this would be things like engaging in play, like we talked about first thing this morning, or kind of moving the conversation on, so not talking about the anxiety, talking about something else, as well as giving physical contact, so hugs, kisses, and cuddles, and then reassurance, telling the child everything's going to be okay, it's all going to be okay. So that is kind of some of the information we gathered on kind of how anxiety might look like in children with DDXRX-related disorder, and these kind of patterns were also common within our children with CAST gene differences as well as other gene differences. So just kind of mentioning that this wasn't specific, but these actually are the specific findings of DDXRX, but this pattern is kind of consistent across different genetic groups. And then in terms of behaviours that challenge, we found that each category of behaviours that challenge was displayed around a third of the children in our sample. And of those that did display the behaviours that challenged, the severity, which was made up of how long that behaviour went on for, how frequent it was, and whether prevention or was required, such as kind of restraining the child from kind of hitting themselves, scratching themselves, or removing the object. So if they were kind of destroying property, removing the object that they were kind of tearing up or ripping up, was highly variable. So although, again, kind of consistent with the anxiety, lots of children are engaging in these behaviours, but when we actually go on to look at how severe they are and potentially the impact they're having, that kind of varies from child to child. So in terms of what specific behaviours children engaged in, we found the most common self-injurious behaviours were biting the self or hitting the self with a body part. The most common aggressive behaviours were pulling and grabbing others, as well as hitting others with a body part. And the most common destructive behaviours included tearing and ripping small items, so like books or pieces of paper or receipts, kind of leaves, anything you can get your hands on, or slamming, hitting, kicking doors or windows. And other kind of behaviours that challenge that were reported but kind of don't fit under these kind of broad categories were inappropriate vocalization, so this is screaming or shouting, as well as pica, which is the ingestion of non-food items such as paper or leaves. So I think this paints up a picture and gives us a bit more information about not just how many children are engaging in these behaviours, but what these behaviours actually look like, which is really important for when we're thinking about what intervention strategies we might want to use in the future. And then coming back to this question of whether anxiety and behaviours that challenge are specific to DDXRX, or maybe kind of what we would expect in terms of the range of behaviours that you see in children that have a genetic neurodevelopmental disorder. So using a range of different questionnaire measures, we didn't find any differences in total emotional behavioural problems or in 3 measures of anxiety symptoms between children with DDX3X-related disorder, CAST-related disorder, or any other rare single gene condition that's been linked to neurodevelopmental difficulties. It's not displayed on this figure, but we didn't find any difference in the proportion of individuals that engaged in each of these categories of behaviours that challenge. But we actually found aggression severity and property destruction severity were higher in our kind of mixed group of children with other rare genetic causes of neurodevelopmental disorder. So I think what's really important about these findings is that they're telling us that these behaviours are actually quite common across individuals that have a range of different rare genetic syndromes. And why I think this is important is because we can think about interventions or strategies that might be used in different conditions or in children with other neurodevelopmental disorders, and how we can use those in individuals with DDXRX-related disorder as well. So to summarise, from our findings, we found around more than half of individuals had anxiety or experienced anxiety symptoms. Common triggers of anxiety were unpredictable and uncertain situations, and common behaviours included increased vocalizations, such as crying or shouting. So these were kind of non-speech, non-verbal communication, but things like crying or shouting, increased repetitive behaviours and speech, and increases in self-injurious behaviours. In terms of behaviours that challenge, we found that around 1 in 3 children with DDX or X-related disorder engaged in behaviours that challenge, and common self-injurious behaviour included biting or hitting the self. Common physical aggression included hitting, pulling, or grabbing others. Common property destruction included hitting, kicking, slamming doors or windows, or tearing apart small items. And other kind of behaviours included inappropriate vocalizations, or pica, which is the ingestion of food items. And just coming back to this point that anxiety and behaviours are challenge are not specific, but what might be actually contributing to this kind of higher rates of anxiety that we see in individuals with rare genetic neurodevelopmental disorders? So findings from our interview study, actually open potential future avenues for examining factors that might contribute to anxiety, as well as kind of barriers that might prevent the identification of anxiety in children with DDX or X-related disorder, as well as other rare genetic conditions. So in my interview study, I found that new situations, sensory overload, and routine changes were common triggers of anxiety. And something that these situations all share is that they're all uncertain or unpredictable in nature. And many of you in this room have probably experienced a situation where you don't really know what's going on, you start to feel a bit stressed, you start to feel a bit anxious. And we know from the kind of broader anxiety literature that this ability to tolerate uncertainty, so how well we cope with situations that are uncertain, is a predictor of anxiety symptoms. And we know in kind of some other rare genetic syndromes, so Williams syndrome, Fragile X, and Cornelia de Lange syndrome, that this kind of inability to tolerate uncertainty, so if you have a higher inability to tolerate uncertainty, it predicts higher anxiety symptoms. So potentially, an inability to deal with uncertain or unpredictable situations might be a mechanism that is leading to higher anxiety symptoms in individuals with DDX or X-related disorder and other rare genetic neurodevelopmental disorders. But we don't know yet. We need to do a little bit more work there. We also kind of found in my study that children with DDX or X-related disorder, when they are anxious, they show higher vocalizations. This is not verbal communication, kind of speaking words, but things like shouting or screaming, and higher behaviors that challenge. This has also been shown in another study of autistic individuals who speak few or no words, so having a similar pattern of verbal communication abilities to girls with DDX or X-related disorder, showing kind of increases in shouting and behaviors that challenge. Whereas in contrast, children with Williams syndrome, so another rare genetic syndrome, but this group have relatively kind of good communication skills. They can kind of speak in sentences, and whereas we know that kind of children with DDX or X may have kind of more minimal communication abilities. So children with Williams syndrome self-report feelings of anxiety. And I think when you look at these patterns of findings together, they suggest that maybe communication ability is influencing the way anxiety might present or manifest. So in children who have more limited verbal communication ability, maybe anxiety is manifesting in changes in kind of increased shouting or as behaviors that challenge, whereas in individuals that can communicate and express feelings of anxiety, that might lead to reports of anxiety rather than this kind of behavioral demonstration. And I think this is important because we actually know in other neurodevelopmental conditions that having higher communication ability leads to higher endorsement of anxiety diagnosis through the diagnostic criteria of the DSM-5, which is the system that we use to diagnose mental health conditions in the US, but in Europe you use the ICD-11, which is very similar. So actually maybe communication is a really important factor to take into account when we're working with children that have DDX or X-related disorder. We don't want to let communication undermine the recognition of emotional and behavioral problems. So yeah, I also just wanted to say, so yeah, communication might be an important point that is influencing whether anxiety is identified and recognized. And also we might have our research might point to mechanisms that are involved, and we know that things like talking therapies have been designed and developed for individuals, for thinking about intolerance to uncertainty, and they have been started to be trialed in individuals who are autistic who might have communication difficulties. So can we take any of the interventions that we already know work for anxiety in children that don't have a rare genetic condition and modify them to be at the level that is appropriate for communication abilities? So yeah, in kind of conclusion, we want to make sure that communication doesn't undermine the identification of anxiety. And also when we see behaviours that challenge, we want to think maybe anxiety is something that's contributing to this rather than pain or frustration or aggression. So thinking about really assessing the function of behaviours and why they might emerge. So yeah, I think that's everything I wanted to say, and I'm happy to take any questions. But thank you to all of the families that took part in the project. I know some of you are here today, as well as the charities that supported recruitment, and then the bingo team based in Cambridge. So
Dr. Jessica Martin.
Or almost, not quite yet.
No?
Not quite yet, doctor. Soon to be.
But soon to be.
Yes.
How close?
July.
July.
So not too long. Yeah.
Are you excited or stressed?
I think I'm excited to no longer have to write my thesis, I would say.
Oh, you no longer have to? It's like,
Yeah.
so it's already submitted?
No,
Like
no.
no. You will have to sit down and...
Yes, I will have to sit down and write all of this up. But yeah.
Is it going to be on this topic?
Yes, yeah, this is part of the project. We also have done some play-based assessments where we've looked at self-regulation abilities and whether self-regulation might predict anxiety. So if you're worse at regulating your emotion, maybe you're more likely to go on to experience emotional and behavioral problems.
All right. Let me check if there are some questions. Great.
I'll put this down.
Well, first of all, thank you very much. I'm Francesco. We met at the hotel this morning. So I'm learning from you today that I mean, my daughter, she's five and a half, and she practically destroys toilet paper. I mean, we need to hide toilet paper. And today I'm learning that maybe it's part of destructive behavior. I mean, this is more a pedagogic question as a father. I mean, we treat her as a girl destroying toilet paper. So I mean, we don't yell at her, but I mean, we try to give the information that we don't like this thing.
Yeah.
While in the anxiety, the reassurance, the hugging, etc., we do that. But in terms of education, what should we do when we have these destructive behaviors? I mean, because we treat her as a girl destroying toilet paper.
That makes sense. I'm not a clinician, so I don't want to give out clinical advice. But something that I think is really important is to think about when these behaviours occur, maybe thinking about what happens beforehand and what happens afterwards. And if you can maybe make a diary about this and kind of talk it through with your pediatrician, or if you have a psychology team, to try and think about why this behaviour is happening. And if you can kind of try and work out why, then it might help you think about what's the best way to kind of respond to that behaviour. And if it's kind of an emotional response, or she's trying to communicate something to you, maybe she's angry and that's why. But kind of maybe making a kind of record of this, and then being able, once you've kind of got that record, you can kind of see if there's any patterns that emerge.
Do you notice a pattern of when she usually does that, or?
No. I mean, I will put more attention, because I mean, again, for us was just being a little bit naughty, but I mean.
Yeah, I mean, there's potentially lots of different reasons, but I think that
same thing. She eat it, or does she just destroy it?
No, just destroy it.
Okay, mine actually bites it. Same thing. But my question is, can it happen because of sensory overload?
Yeah, there's definitely a possibility that that could be a response to kind of feeling really overwhelmed sensory. So I think something that I've kind of come away from my research is really trying to think about why behaviours are happening. So the function, are they trying to communicate something to you, and kind of thinking about that. And I think the diary method, and thinking about also how you respond. So if you're kind of reassuring someone, maybe that's telling them that actually that behaviour is okay, and kind of working that through with your clinical team is really important.
Hi. Has any of the parents ever reported pinching?
Yeah, pinching, grabbing.
And how they're dealing with it?
Yeah, I mean, I think a lot of the time it's quite hard to think about different ways to manage these behaviours, especially when they're having kind of an impact on other kind of members of your family or yourself. But yeah, I think parents kind of described managing things in lots of different ways. Kind of distraction was definitely the most common. But yeah, I think if you have a clinical team thinking about maybe different kind of emotion regulation strategies that you could use, or different ways of kind of managing behaviour.
Jessica, you talked about, existing therapies that can be modified. Can you just expand a bit on what they are, and is there any studies ongoing on that?
Yes. So most of my knowledge within kind of the anxiety space, so if any of us in this room maybe experienced anxiety, we would receive a kind of talking therapy. So there are now people looking at modifying kind of talking therapy for children that are autistic, or thinking about kind of more behavioral strategies that you can use. So I think in terms of anxiety, there's a trial ongoing at Newcastle called Cues, which is about anxiety in autistic individuals, but again with potentially a similar pattern of social emotional communication difficulties. Yeah, I can share that.
That's great.
Okay. Quindi non è una domanda, è una constatazione. I would like to ask a question that is not a question, but can self-regulation be learned? Can they do it by themselves? Because maybe we have some strategies that we are trying to apply with them. We were talking about using these, for example. There will be a moment where they by themselves could learn how to calm down. Self-regulation is something that we can learn and maybe avoid anxiety.
Yeah, I guess self-regulation is something that we all learn over developmental time. So when you're born, babies don't regulate their own emotions or their own needs. And that's something that you learn through development. So that tends to occur, the kind of ability to start self-regulation tends to emerge around 2, 3, 4, and it kind of develops throughout childhood. And it might be the case that individuals who have developmental delay or intellectual disability are on a slightly different developmental trajectory. So maybe that's actually protracted, it takes longer, it might emerge later. So I think thinking about working with your kind of pediatric team or kind of clinical psychologists to develop kind of emotion regulation strategies that you might be able to use, or thinking about if they are engaging in challenging behaviours that might be harmful to themselves or others, are there different ways you can teach them kind of strategies to manage or different behaviours? So actually maybe is that having a stress ball or something else that they can use, a fidget toy that's kind of non-harmful but kind of satisfies that kind of self-regulation need, that external kind of aspect.
Thank you for that. Gloria from Italy is joining online and asking about the criteria that you use to differentiate between medium anxiety and severe anxiety.
Okay, yes, so the measure that we use in our study is not a diagnostic measure. It is a measure looking at range of symptom severity. So this is a standardized assessment measure called the Developmental Behavior Checklist that was designed to look at a range of different emotional and behavioral problems in children that have and adults that have intellectual disability. So we use the standardized cutoffs for that measure, but that's not diagnostic, and it might actually, so different measures might look, sorry, I'm not explaining myself very well. That is not a diagnostic measure, and we use the standardized criteria, but it might be the case that the threshold is different if you use a kind of strict diagnostic criteria where you might not take into account differences in presentation. So usually to be diagnosed with anxiety, you're required to be able to express that you're worrying and kind of communicate that feeling, and we don't have that in our diagnostic criteria, so actually maybe we're picking up on behaviours that is presenting that differently. But yeah, that wasn't a diagnostic measure, but it's using standardized criteria.
Thank you. Mugurel from Romania asks about the age that the signs of anxiety can appear. His daughter is 1.5 years old. Is it still too young to observe such things?
I can say what I know about developmental trajectories in children that don't have neurodevelopmental disorders. We don't yet have kind of prospective studies that look at changes in anxiety symptoms in children with developmental disorders like DDX3X related disorder. So anxiety is one of the most early emerging mental health conditions, and it tends to emerge in children without developmental disorders at around 6. And then, but the types of things that kind of cause anxiety change throughout age. So when, for children are much younger, potentially even kind of 3 and 4, separation anxiety, so this fear of being separated from your parents or caregivers, and specific phobias, so maybe of kind of loud noises or kind of scary objects like clowns are more common. And then as you get older, that changes, and you're more likely to get diagnosis of things like generalized anxiety, which is kind of worry about everyday situations or future events. So there are changes, and I think something that you should take away from my research is that actually anxiety, even though many children might go on to experience it, it's variable, but not, anxiety isn't something that every child with DDX will experience. So I think with your daughter, just kind of keep an eye on this, and if it's something that is a concern for you, raise it when it becomes a concern.
We'll have one more question from Anna from the UK, but now it's you.
I'm just wondering, did you see a progression in age and a drop-off in anxiety or an increase in anxiety, or did you look at those parameters at all?
So we're not able to look at it in our data because we only look at it at one time point, so we can't see how anxiety changes in individuals, and I don't think I have enough people to kind of look at really young children versus older children. But yeah, there is kind of changes in trajectories of the things that might trigger anxiety and patterns of anxiety in children without developmental disorders. We just don't have that data yet. Maybe, yeah.
Maybe from your PhD or for your, what's the next level?
What's my next step?
If you have a PhD, then you do the...
I'm hoping to do clinical training, so then I could give you clinical advice and feel more confident.
Maybe
but
that. Maybe
yeah.
that. Anna from the UK would like to say that it was a great presentation, Jazz.
Thank you.
She's proud to have been part of the Bingo project research.
Thank you.
Has the study, or will the study, look at strategies for parents to support anxiety and behaviors that challenge?
Yeah, so we asked parents how they cope and manage with anxiety, and that will be kind of written up as part of the thesis and hopefully published literature as well. And we kind of discussed the different strategies and how some strategies might actually maintain anxiety. So we know in the general literature things like avoidance, actually, if you avoid something that always causes you to feel anxious, then when you do encounter it, it's much more stressful. So actually maybe kind of avoiding situations, because it never gives you the opportunity to learn how to manage distress and cope with that distress or that uncertainty, that can become kind of much stronger. So I think that there are things you can discuss with your kind of clinical teams around kind of ways of coping that actually might not maintain the anxiety or the difficult behaviors, but it depends kind of what is that trigger and what's causing it as well.
Anna also would like to know if there are any plans to look at anxiety in adults with DDX3X.
Yeah, so I limited my study to younger children under 18, and that's because I was really interested in, when I first started out my PhD, in looking at kind of developmental mechanisms, so thinking about the emergence of self-regulation. We don't have any future plans to look at kind of adults, but we definitely do have adults in our cohort. We just haven't kind of looked at that yet. So there might be future PhD students or people in the future, if they want to take that up, I would definitely encourage it.
Anna's experience is that anxiety tends to increase after puberty.
Yeah, so we know that puberty is a kind of difficult, can be quite a challenging emotional stage. So you're going through hormonal changes, also there might be changes in education and expectation, what's kind of going on, as well as changes in kind of social relationships. We know this is true for children without developmental disorders. So it's kind of a window where there maybe is more risk for developing an anxiety disorder, but that's not true for everyone. Yeah.
Professor Affe, you wanted to ask a question as well?
Thank you for your lecture. I want to ask about self-injurious behavior. It's really when the intellectual capacity is higher, the anxiety and the self-injurious behavior relationship is more constant. However, when the intellectual capacity is lower, the impulsivity much more important than, I think, the anxiety, the internalizing traits. So what do you think about the impulsivity component of impulsivity component in the self-injurious behavior?
Do you mean whether the behavior is like an impulsive reaction?
Yes.
Like a compulsion?
Yes.
Like a compulsion? Like
impulsive reactions, like a hitting or banging themselves, like this.
I would say that there probably is like an impulsivity element. I'm not able to kind of pull that apart. I think we're also not clear what the relationship is necessarily between severity of developmental delay and these behaviors. So one thing that's kind of come out of both our previous project, which I kind of showed where we found higher self-injury, and my most recent project, is that we also looked at how these different traits might relate to each other. And something that we found that's consistent across both cohorts is that you see a correlation between higher anxiety and higher autism traits. And that's something we know from the broader literature, that people that are autistic tend to experience kind of higher rates of anxiety than people in the general population. So I think it's really hard to pull apart these different behaviors and how they might be related and contributing to each other. But I think we definitely need that relationship to kind of understand the broader phenotypic picture and kind of what might be leading to different things. So is it when I'm anxious, I engage in self-injurious behavior, or are they kind of separate from each other, and it might be different for different people. So yeah, I can't really comment on the impulsivity, but I think we definitely need more work to kind of look at how different dimensions of emotional behavioral difficulties are interrelated and kind of contributing to each other as well.
I have to say, you've received a lot of questions.
Yeah, I know, thank you. It's really, really great.
And my last one is about Ursula. Would you like to introduce her?
Yes, I can introduce Ursula. I met Ursula at the meeting in Paris, which was actually 2 years ago now. She corrected me. I thought it was only last year. It's been, time's flown by. And she has a daughter, and we actually met, and you took part in the bingo project, and it was really great. But you've now gone on to do your own research looking at DDX or X-related disorder, and I think focusing on the kind of relationship or difference between individuals that are autistic. So very excited to hear more about it.
And thank you very much, Jessica. It was great to hear from you.